This video is intended to be educational for patients that are having a Shouldice hernia repair. So now I'm going to talk a little bit about the second day after surgery. If you haven't watched the video about the first day after surgery, please go ahead and watch that because the second day is very similar to the first. Most people have the same amount of pain or discomfort as they did on the first day. Some people will have a little bit of worsening of the pain because I mentioned in that previous video that on the first 48 hours, there's more and more cellular swelling, and cellular swelling causes swelling of your tissues, which pushes against our sutures, pushes against the nerves that we've moved around in your surgery. And so oftentimes that second day is sort of the peak of the post-operative pain. Again, Tylenol, ibuprofen, ice works for 90% of people, and rarely people start feeling less pain on that second post-operative day. And if you're that person, that's wonderful. Usually by the second day after surgery, you will notice some swelling around the surgical site. Oftentimes the surgical site will not be the exact site of where you felt your hernia because we've repaired the hernia at the root of its problem, not where you've noticed the bulge. But that means that there will be swelling in two locations, one where you noticed the bulge and one where we actually fixed the hole that caused the hernia in the first place. With a Shouldice repair, there's often the beginning of a healing ridge that you will start feeling. And this is really the first day it's going to become noticeable. Also, a little bit of bruising and swelling is fairly common by the second post-operative day. Bruising can be black, blue, purple, yellow. The colors change over time, and a few drops of blood will discolor the skin and travel through gravity. So if you're a male, you will notice that your inner thigh will get black and blue. The top of your scrotum will be black and blue, and sometimes your penis will turn black and blue. I joke with my male patients that it looks like something is gonna fall off because it can be pretty scary looking the first time you see it. Usually that second day after surgery till about 2 weeks is when people see this. I learned over time that when I tell patients about this, A, it's a good laugh in a preoperative setting. B, it saved our patients a lot of anxiety and some phone calls not knowing what to expect. So in women, that black and blue can travel down from the surgical site down again to the inner thigh and down toward even the labia that can become completely discolored. So don't be surprised. Again, black, blue, purple, yellow, even shades of green I've seen from patients post-op. It's just as the body absorbs that blood, it absorbs it at different rates, and people's skin colors are different, so there can be different shades. So don't be alarmed with any of that. Be happy if you don't experience it, but don't be alarmed if you do. Also, don't be alarmed if it happened on post-operative day 1 or if it happens on post-operative day 5. Everybody's a little different.